All right, let's talk a little bit of muscle imbalance that I typically see in runners and cyclists. So, this is going to be particularly talking about cyclists who end up getting a little bit of knee pain. Oop, ignore that pen. So the first thing I want to talk about is called the Q angle, okay? That Q angle is basically the angle of force that your quadriceps is putting on your knee joint. It affects the stability of the knee joint, the tension level of the knee joint, and the way you measure it is from the very front part of the hip bone with a straight line that goes straight through the middle of the kneecap, and then the remaining line would be going straight down. And it's that difference in straight line that is the Q angle. So forgive this not so awesome keyboard drawing on my mouse pad. Okay, so you can see if I continued that line, it would keep going. But if I draw my line straight down, this angle right here is your Q angle. You can also look at it from this side, it just kind of depends, but technically the Q angle's in here. Now, all that to say, let's clear this. If I naturally, so females are about a 13-degree angle, males about an 18-degree angle because hips are a little bit more narrow. However, that's natural, but it can be exacerbated and made a little bit worse with some muscle imbalances. So let's talk about that a bit, because what can happen is when you're thinking of this line, whoa, forgive that line, when it's coming down, when typically it would continue on here, but instead it's anchored right here where your patella tendon is. What's going to happen when you repeatedly demand that quadricep to work is its line of pull wants to go this way and pull that kneecap in, right? Your IT band has fibers that attach. It's trying to yank on it and make it come back this way. So what ultimately ends up happening is this kneecap, instead of sitting perfectly in its little groove, can get a little kind of pulled out of its track and either make under the kneecap painful, can make side of the kneecap painful, can get a little quad irritation, things like that. So let's clear that guy. Major muscle groups, and this is why I always look at people do a single leg squat, because it's going to give it away. It's going to show exactly what happens. Typically what happens is that knee buckles in, okay, instead of staying in a nice straight line to have the force going more directly. That comes from a lack of ability to stabilize the hip, rotating it externally. What I mean by that, if we take a look, let's zoom in here. This is your glute max. I'm going to remove it here in a second, but it extends your hip, takes it backwards, okay? So for things like running, cycling, you obviously need that. It's your big, powerful muscle. It's going to be pushing down on the pedal, or going to be pushing your body away from the ground as you push with your glute to push your body forward. Okay, so that one is not typically the biggest issue. Sometimes it is coming into play, but if we take that off and you see all of these smaller muscles, okay? So we'll start with this guy. This is your glute medius, gluteus medius. It has a couple different functions. So it either internally rotates your hip or externally rotates your hip, depending on the part of the fiber that's being recruited. Its main action is to take your knee, or your leg, excuse me, out to the side. Take it straight out, okay? Things that you're not actively doing while you're cycling, but when you're running, if you can kind of reverse this motion and think about when you heel strike, when you land, this guy has to stabilize you, right? So when you're on the bike, when you're pushing down, you want to stabilize. This guy is your main hip stabilizer. The other thing it does is rotate your hip. So this is showing it internally rotating. Okay. Let me show you from the front. Just know it also does this opposite. Where the foot would go in, knee would go out. It just does not have that one on here. Now, all that to say that it comes into play a lot with knee pain. So do these guys. So the piriformis muscle, this one gets a bad rap with sciatica, because you see the sciatic nerve that sits right underneath here. If this one starts having a real bad day, it starts pinching on this. But what its main job is to rotate that leg out, like I was just talking about. So if we're looking at it head on, rotating knee would be going out, kind of like a clamshell if you've seen that. So that muscle and the glute medius muscle, very important for stabilizing the hip and keeping that knee in line. So if it's not tracking in line, and these other guys all do very similar things, they either rotate in or out. The other one I wanted to show you, your TFO. This guy, this one is going to flex your hip forward. It is also going to help take that leg out to the side, and it's also going to internally rotate the hip. So what can happen, especially in cycling, and in running too though, but in cycling, when you're clipped in and you have to pull your knee up and drive, you got a few hip flexors. This is one of them. You have your main hip flexors that you think of. Let me take this off. That's psoas muscle that people think of in your iliacus. And one of your quadriceps tendons, right? So when you're yanking up to keep pressure on the pedal, you're activating those. That TFL that I wanted to go back to, it has a pretty important role in the sense of it is the main muscle that feeds directly into your IT band. Okay, now if we're going back to what we were talking about with that Q angle, if that knee is wanting to drop inwards, let's just go ahead and draw this on here. If every time your heel is coming around, knee is coming around on your pedal stroke, if your knee is wanting to drop in, okay, now we got this TFL muscle that's firing because it's trying to flex the hip up. It's wanting to fire. It can also internally rotate the knee a little bit. It's connected to this IT band, which can then also pull on the kneecap, start pulling it a little bit over this way. And then we just get this big, unhappy ache in the knee, pain in the knee, right? So let's clear all that off. Let me show you one other little thing, nerve-wise, and then hopefully you have a little better understanding of what is going on and why your hip is so important and why you get so many hip exercises to address a knee problem. So let's zoom in and let's look at some nerves in the area. So I'm going to take off all the muscles. Actually, I'll show you this guy. This is the articularis genu muscle. Very small. All it really does is help elevate the knee capsule, okay, during extension. So when you are straightening your leg, you have a capsule that lives around your knee, okay? There's fibers in here. It helps to lift it so that when you are straightening your kneecap can ride up and everything is all comfortable. Can get a little fatigued, things can happen. So that is why I typically address that with deep tissue, and I'll teach people how to do that with the lacrosse ball. All right, we take all of that off. We just look at nerves. Anything that's yellow on here is a nerve. So this one is one I wanted to definitely show you. So it's called your articular branch of your tibial nerve. Tibial nerve is just a branch off of your sciatic nerve, that big one that was in the butt cheek, right? So if those muscles in the butt cheek get fatigued and then that muscle group cramps up around your sciatic nerve, things can get a little irritated down the chain. But I always like to point this one out because what this guy does is it supplies the interior, this medial part of your knee, but it also does the actual knee joint and the knee capsule, okay? It also does a ligament back here on the back of your knee. But it's important because a lot of times people will feel pain and not realize there's a nerve. That irritation higher up could result in this nerve giving the sensation of pain into a different area. Now, people that have pain directly behind the kneecap, that can be a referred sensation. It can be a little wear of this cartilage. It can be where that articularis genu is getting irritated in the joint capsule. You have smaller nerves, little hair-like ones that they don't show on this, but there's definitely options of nerves that can go to the area. So that in a nutshell, pay attention to the hips when you're looking down and you're running. If it looks like your knee is going in, when you're cycling, if you see that little lollipop when you've been fitted, and they're like, hey, when you're riding, your knee tracking comes up, knee does this little lollipop because it's coming in, going back out, and then goes back down. You'll see that because when you are going around your pedal stroke, when that knee wants to come in, then it corrects. And then you come back up, and then it goes back in, and then it corrects. So you get this little lollipop. So something to be aware of. Hope that was helpful. Sorry this is a little long.